And let's begin by understanding what we mean by unnecessary deaths. In the story of the COVID-19 pandemic, this doesn't just mean deaths that happened. It means deaths that didn't have to happen. These are lives that could have been saved if we had used all the tools and knowledge we had available. Things like timely public health actions, policies based on solid science, and making sure everyone had fair access to health care. So, how do we measure this? Scientists use a concept called excess deaths. Think of it like this. Every year, a certain number of people in a country pass away from all sorts of causes. We can predict this number based on trends from previous years. This is the expected deaths. Now, during the pandemic, we saw the actual number of deaths, the observed deaths. The difference between what we saw and what we expected is the excess deaths. The equation is simple. Excess death equals observed deaths minus expected deaths. For the United States, from 2020 through 2023, that number was staggering, about 1.3 million excess deaths. That's like the entire population of a major city like Dallas or San Diego simply gone. But not all of those excess deaths were unavoidable. This is where the idea of unnecessary deaths comes in. We can think of it as a fraction of those excess deaths, the ones specifically tied to failures in our response. Scientists have tried to measure this preventable toll in a few key ways. First, by comparing the US to other countries. Researchers at Columbia University estimated that if the US had rolled out vaccines as quickly as Europe and put mask mandates in place just 2 weeks earlier, we could have saved between 140,000 and 210,000 lives. Another study compared us to our neighbor, Canada. If the US had the same death rate per person as Canada, over 300,000 American deaths would have been prevented. Second, we look beyond COVID itself. The pandemic disrupted everything. People delayed cancer screenings, struggled with mental health, and the opioid crisis got worse. The CDC found about 240,000 excess deaths during this period that weren't even directly from the COVID virus, but from these ripple effects. To understand the full weight of this loss, scientists use a measure called DALYs, which stands for Disability Adjusted Life Years. Let's break that down. A DALY measures the total burden of a disease in 2 parts. Years of life lost. That's when someone dies prematurely. For example, if the average life expectancy is 75 and someone dies from COVID at 60, that's 15 years of life lost. Years lived with disability. This accounts for the time people live with poor health. For someone suffering from severe long COVID, each year is assigned a weight to represent its difficulty. Add these 2 parts together and you get DALYs. For the US COVID crisis, the total was a heartbreaking 34.5 million years of healthy life lost. To put that in perspective, one study found that delaying school closures alone cost over 1.1 million of these life years. So, why do we call this a story of unnecessary death? The evidence points directly to specific choices. Choices like defunding pandemic preparedness programs. Before the virus even emerged, choices that allowed dangerous misinformation about masks and vaccines to spread, which one analysis links to over 300,000 deaths among the unvaccinated. Choices that left doctors and nurses without enough protective gear. The numbers tell a stark story. While the virus was a global threat, America's suffering was uniquely severe. Our death rate was nearly 3 times higher than countries like Germany and Australia. This wasn't bad luck. It was a preventable catastrophe. In a survey, 83% of epidemiologists, the scientists who study diseases, agreed that a substantial number of US deaths were avoidable. We became the outlier among the world's richest nations, not because we lacked the knowledge or the hospitals, but because, as a nation, we failed to fully use them. The story you just heard in this chapter isn't just history, it's a warning. And this warning is not over. The policies, the failures, and the human cost we've documented in unnecessary deaths continue to shape our world right now. If you want to understand what happens next, you need to see the full picture. On this channel, we're not just releasing the audiobook, we're building on it. We'll be diving deeper into the data, tracking the real-world impact of the policies discussed in this book. By subscribing, you're not just getting the next chapter. You're joining a community committed to learning from the past to protect our future. Subscribing is the easiest way to ensure you don't miss a single video. Here's what you can do right now. Hit the subscribe button. Click that bell icon to get notifications so you know the moment the next chapter is live. Check the links in the description below to get the full ebook on Gumroad and dive deeper at your own pace. The most dangerous lesson we can learn from unnecessary deaths is to look away. Stay informed, stay engaged, and please, subscribe. Thank you for watching and for caring enough to listen.